Governor Mike Pence says he's assembled the best minds to gather information and come up with a fresh approach to tackling the state's drug abuse problem. This week, Pence announced the creation of the Governor's Drug Abuse Task Force. The 21-member group is touring the state to meet with local leaders and get a sense of what's happening in communities that's leading to the drug epidemic. From 2003 to 2013, the number of heroin overdose deaths in Indiana increased nearly 5,000%. And the Hoosier State ranks 16th highest in the country for all drug overdoses. Pence says the Drug Task Force will identify gaps in enforcement, treatment, and prevention, and develop solutions for the state. And as Brandon Smith reports, Pence is giving them a tight deadline. He wants recommendations from the task force as early as this fall.
The task force is comprised of law enforcement officials, physicians, a bipartisan group of lawmakers, and major agency heads. And Pence says the focus can't simply be on punishing drug users.
It is axiomatic to say that while it begins with law enforcement, we simply cannot arrest our way out of this problem.
Pence is charging the task force with developing a comprehensive plan to break the drug abuse cycle. Democrats accuse Pence of being late to the game and say a comprehensive strategy is something they've been advocating for more than a year. In Scott County, an HIV outbreak has reached more than 180 cases. Nearly all of those have been linked to prescription drug abuse. Local officials say for years prior to the outbreak, they pleaded with the state for help addressing the drug problem.
Ever since I opened my practice in 2004, it was obvious that there was a problem with drug use here. Been asking for help for a long time.
Well, thank you all for being here, and this will be the first meeting of the Task Force on Drug Enforcement, Treatment, and Prevention.
The creation of the Drug Task Force comes 7 months after the governor declared a public health emergency in Scott County, allowed the county to establish a needle exchange program, and allocated state funding and additional resources to address the HIV epidemic.
One thing that's important about syringe exchange programs is that it's not just about giving out needles. It's about mounting a comprehensive response. In Scott County, we provide connection to addiction and recovery services. We provide HIV testing. We connect them with the Department of Workforce so that they can get jobs.
State Health Commissioner Jerome Adams is one of the members of the task force. He says as the group works on developing a statewide drug prevention strategy, a syringe exchange could be on the table. Pence, for his part, says he won't prejudge any recommendations.
This is how Hoosiers like us to operate. Let's come in, let's have an open mind, let's figure out how to work the problem in new and renewed ways, and with the end result that our families are safer, and our law enforcement community, our social services community, have the resources and the tools to be able to do their job with greater effectiveness.
For Indiana News Desk, I'm Brandon Smith.